people that are applying for unemployment have lost access to their health care through their employer, right? Because they're without a job. So this crisis amplified so many of the issues that we face here in Michigan and all across the country. So it opens up the opportunity to have a discussion of what Medicare for All looks like. And as we continue to have the conversation, I'll share a little bit later about what we were able to do at Michigan United with the work and help of Representative Abdullah Hammoud, Mari Manoukian, and Darren Camilleri. And I'm also going to talk about how we can use relational organizing to push forward resolutions in local municipalities to encourage cities, townships, and other communities to push forward for Medicare for All support resolutions. So with that, thank you all for tuning in. I want to acknowledge our electeds that are here. We have Michigan First Single Payer, led by Eli Rubin, that are going to be sharing a little bit of their thoughts. We have the Congresswoman from the 12th, Debbie Dingell, who I consider a good friend and someone that I can always call on when there's tension. And we have from Detroit, Councilmember Raquel Castañeda-López, and out of Ann Arbor, from the state legislature, the Democratic floor leader and fellow movement politician, Representative Yusuf Rabi. So with that, I'll pass it back to Melinda, and we'll begin this conversation. And we hope that there's going to be a lot of action items for you guys to go home with. It's not just us lecturing you and telling you why Medicare for All makes sense, because everyone here, we hope, understands that it makes sense, which is why you are all on this call. Melinda, back to you.
Great, thanks so much. Well, so I really am honored to welcome Congresswoman Debbie Dingell, who represents Michigan's 12th Congressional District. She's the lead co-sponsor for the Medicare for All Act of 2019. And an enormously powerful advocate for health justice and many issues. Really want to have your insights about what's happened.
Did you introduce me?
Yes, I did.
I think so. There was a brief disconnection.
Yes, I did introduce you. Can you hear me now?
I can.
Okay, well, we're really honored to have you. I was saying that you are the lead co-sponsor of the Medicare for All Act of 2019 and a powerful advocate for all progressive issues. And we would honored to hear your perspective on the crisis now and what activists can do. Thank you.
Thank you. Sorry, we had that moment of technology. You know, we're all learning a lot more about technology during this. Let me put it this way. I've been home alone for 32 days with no physical human contact. We're all going stir crazy. But I will also say, as I start this out, and I thank the Progressive Caucus Center and Public Citizen for hosting tonight's event, that we've seen a microscope placed on the disparity on our healthcare system, but we all really do have to understand this is an invisible enemy that has the ability to kill so many people, that as frustrated as we are, and I'm probably the most frustrated of many that you know, we have to do what the scientists say. So having said that, I'm really excited that you all are hosting this, and I have to give a special shout out to my friend Abraham, because his support and his leadership on this fight for Medicare for All has been incredible. And I'm also lucky just to call him a friend. We're having this tonight at a really critical moment. Michigan is one of the hardest hit states by COVID-19. We are, at any given day, or third or fourth, it's not a contest you want to win, for the highest number of COVID cases in the country, and we are third on the number of deaths. People are scared. They're worried about their future. We're going to get through this together, but the crisis has laid bare the cracks and the flaws in our for-profit healthcare system. People shouldn't have to be worried about whether they have insurance or not in the middle of this pandemic. They shouldn't have been worried about whether they could afford the test, whether they could get the test if they got sick, whether they could afford to go to the doctor. And quite frankly, they shouldn't have had to worry about whether they got sick if they could afford to stay home for 14 days. But that's a discussion for another day. But the lack of widespread testing, the lack of access for so many, and the financial situation of our hospitals that they're facing, that they don't have liquidity, that we are laying off employees right now, is making the case for why we need to transition to Medicare for all. It would be more equitable, it would be more fair, and more responsive to future crises like the ones we're facing. People don't realize, and we don't talk about this enough, we are the only industrialized nation in the world that doesn't guarantee every one of its citizens health care. It's got to change. Not just because it's the right thing to do or it's the moral thing to do, but because tying people to employers for health care holds back innovation in entrepreneurs. It's a difficulty for employers. And right now, millions of people have lost their jobs or are on furlough or are collecting unemployment right now because of COVID-19. And the healthcare that they had comes along with it. And the COBRA payments that they would be able to pay for are $2,000 a month. When you're in unemployment or you've been furloughed and you're worried about how you're going to live, a $2,000 COBRA payment isn't affordable. This pandemic is highlighting all of the immense flaws in our system, and people are left hanged, just being hung out to dry because of it. You know, a lot of people don't focus on the fact that we spend twice as much per person on healthcare compared to countries with systems that have universal healthcare. And we still have 27 million people without insurance. And we have far worse healthcare outcomes. We have a lower life expectancy, and our infant mortality rates are just simply unacceptable. The current systems resulted in disparities in this country that mean how long you live is determined by the zip code you live in. Before the COVID-19 crisis, I've had African-American women tell me that there's no point in getting a mammogram because even if they have breast cancer, they can't afford to get they wouldn't be able to afford chemotherapy or get the treatment that they need. In Michigan, 37% of our minorities are not insured. It's a broken system that disproportionately impacts low-income families and minority families. Now, what are we watching? We're watching Detroit and Michigan's get hit harder than most by COVID-19 because of the disparities that we have. It's not acceptable to anybody. And that's why Medicare for all is the answer. If we want to stay competitive with our peer countries, we've got to transition to a more efficient system. And we're coming together today because we've got to fight this at a grassroots level. We've got to support, excuse me, I don't have COVID, I have allergies. We've got to support universal health care for every single person. This issue is so important, and it's very personal for me, which is probably one of the reasons that I am so passionate. And I know that most of you are on this because you care about it too deeply. It's personal for me because every day I hear heart-wrenching stories. You know, I used to take John to the doctor before he died. We went a lot. And people would stop and tell me their stories. The man who couldn't afford his insulin, the mother that had a 10-year-old daughter that had juvenile diabetes and said, if they take away her health care because she has a pre-existing condition, I don't think she'll grow up to be an adult. The mothers and the fathers and I have so many stories that I could tell you. Even when I miss John, I really miss him this month. But when he was being taken to the hospital, we were here at Fairlane, and he was being wheeled out on a stretcher because the doctor thought he had had a heart attack. He stopped and he talked to everybody in that lobby and asked them what their stories were. And people would tell us the truth. And people were scared. They couldn't afford their medicine. We can't live in a country like this. So, and I want to just tell you all that it's also really personal to me because of my family's own history. John Dingell's father introduced the first universal health care bill in the early 40s, after Social Security passed. And by the way, I've gone in and looked at congressional records and newspaper articles. People called John Dingell's father, whose name was John Dingell, a communist, a socialist. They said it couldn't happen. And actually, FDR supported it. After John's father died in 1955, he introduced universal health care in every session of Congress. And you know, people say we can't get it done or it's the impossible. Well, that's what they told him. And Medicare came about in 1965 because they never gave up. And then we saw the passage of CHIP. We've seen other things. We then saw the Affordable Care Act. Well, it's time to get this job done. And I made that promise to John on his deathbed. I am missing him. I'm really telling you the truth. So I spent a lot of time. I was a caregiver. So I really heard the stories all the time. And we were lucky. We had insurance. But I saw how broken the system was then, how difficult it was to navigate it. I'm an intelligent woman. I'm supposed to be able to work the system. When he went into the hospital into intensive care the day after he finished serving, I was pounding my head against the wall. I could not make the system work. You know, it was rules and bureaucracies. And if I couldn't make the system work, think about what it's like for somebody else. I'm really glad that you all are here tonight. We've got a Medicare bill that's been introduced in the House. We've actually had congressional hearings, and it's been a long time before House hearings have ever been held. I have worked with Bernie Sanders on this issue, on this and Social Security. Just because he's not a candidate for president anymore doesn't mean he's giving up or I'm giving up. And I'm not giving up till every American has access to health care. Thank you for being with us tonight.
Thank you so much, Congresswoman Dingell. We're so grateful for your leadership and your passion on this issue. Next, I am honored to welcome State Representative Yusuf Rabhi, who's the Democratic floor leader of the Michigan House of Representatives, representing District 53. He's also the lead sponsor of the state single-payer healthcare legislation. So welcome, Representative Rabhi.
Thank you. Yeah, thanks so much for having me. It's a pleasure and honor to be here with you today with so many participants. It looks like we have great turnout today, and obviously with some great panelists. So my name is Yusuf Rabhi. As was said, I serve as the Democratic floor leader in the Michigan State House of Representatives, and I represent District 53 here in Ann Arbor. And one of the things that I did a couple years ago was introduce something called MyCare, which is basically our state level version of a single payer universal healthcare system. We were not calling it Medicare for all because really our goal was to be more expansive than the services that Medicare provides. We want a full suite of benefits for everyday hardworking Michiganders. And I'm happy to go into detail in the question section about what our bill actually does, but essentially it provides universal coverage for physical health, mental health, dental health, vision, and under the new version that we're going to be rolling out soon, it includes also a full suite of long-term health benefits, which is something that a lot of folks are really passionate about. I know I'm really passionate about as well. We often overlook long-term healthcare needs, but oftentimes those are the most costly to people. And as we're looking at how we push the issue of single-payer universal healthcare, I'm really passionate about doing work at the state level to push this forward because, even though ultimately we hope for a federal solution and we're hopeful that Congresswoman Dingell, who I'm proud to say is my Congresswoman, is fighting the good fight in DC, and we're all, supporting and helping her. We also need to make sure that we're building the movement, building the grassroots, building the foundation right here in Michigan to help push that and make it happen at the national level. But if it's not going to happen at the national level, frankly, we need to start by doing it at the state level. We can't wait. We have to start it now, because every day that we wait, every year that we wait means literally people are dying. And whether that is during a crisis like this or whether that's before a crisis like this, frankly, working families that didn't have health care were in a state of crisis every day before the COVID-19 epidemic, became what it is today. We have tens of thousands of Americans that die every year because they don't have access to health insurance. And that is something that is, in my opinion, it is criminal that we have a private healthcare system that we do, that puts profits over people, and that makes it so that wealthy CEOs can line their pockets literally off of the health of everyday working people that are just trying to make ends meet and live a decent American life. So I've really engaged myself in this work for a number of reasons, because I truly believe it is what is right. It is the right thing to do. It is what we as Americans, to me, it's foundational to who we are as a country. Growing up in America, I didn't see our country as a place that excluded. I saw our country as a place that included, that took care of our neighbors, that cared about one another, instead of casting each other to the wolves, basically. So we can do better as a country. We must do better as a country. And one of the quick stories that I do want to tell, that is a personal story of mine. Some of you on this call have already heard this, but it is very, front and center for me, and really motivates, has kept motivating a lot of the work that I do. And that's a story of my uncle, actually, who passed away about a year ago. And my uncle lived in Nevada. He had cancer, and towards the end of his life was struggling, obviously, with a lot of health issues. He couldn't barely get up. He couldn't barely walk. He couldn't barely go to the bathroom. He could not eat. He had lost all of his body weight, and was basically bedbound. But the last memory that I have of my uncle, I was visiting him because I knew he was, very ill. I was visiting him, and the last memory that I have of him is him essentially using all the strength in his body to stand up, put his clothes on, and go and sit on the porch of his house and wait for his friend to come pick him up to take him to work, because that's how he had health coverage. And so this man who, again, was bedbound, could not eat solid food, was emaciated, and not in a condition to even get up and walk around the house, had to literally go to work in order to have health coverage. There's something fundamentally wrong with a country that allows that. And I've dedicated myself to fighting that type of injustice, because I know that my story is far from unique, and that is the unfortunate reality of the America that we live in today. And there are those that say it's not possible. There are those that say it's too big. There are those that say it's too pie in the sky. We can't make it happen. How are you going to pay for it? Well, somehow we can find multiple billions of dollars to dump into the stock market and lose overnight, but we can't find the money to take care of people like my uncle. I don't think that narrative, that argument that we can't, is really a narrative and argument of we won't. It's really a narrative of argument that says we want to keep the status quo. We want to keep rich billionaires and millionaires lining their pockets with the money of everyday hardworking Michiganders. And the practical reality is that it is cheaper for us to have a single payer universal healthcare system. It is cheaper for America. I support single payer universal healthcare because I want to pay less for healthcare. And that's what is made possible by a plan like MyCare and the plan that Congresswoman Dingell is talking about. We can literally protect all Americans and give them the coverage that they need and save money in doing so. And so I struggle with those that push back. I struggle with those that say it's not practical. I struggle with those that say it's not possible, because it really comes down to a lack of will and not really a lack of opportunity. So I want to thank you for having this town hall, and I'm looking forward to the questions that are going to come forward. We can go into the details of the MyCare bill. I know it in and out, so I can help you answer any questions there, but otherwise I want to hand it back over because I know we have some other great panelists to hear from.
Thank you so much, State Representative Rabhi. We are so grateful for your leadership and your passion on this issue also. Next, I'm thrilled to turn it over to Councilmember Raquel Castañeda-López, who represents Detroit City Council District 6. She led a successful effort to pass a resolution in support of Medicare for All last year. And so welcome, Councilmember.
Thank you. Sorry, I have a cat who doesn't enjoy when I'm on the computer, so I had to put him to the side. I apologize. Yeah, well, first, thank you all so much for having this conversation about this really important topic. I think there's so much going on that there's a lot of different social issues that are just being magnified and intensified in different ways that maybe certain populations weren't aware of, and the access to healthcare is definitely one of them. And so in the city of Detroit, honestly, I think are lucky in some ways in that it was a no-brainer. There was not opposition from anybody on council, so we passed it unanimously. And I think part of the reason is even as we see the disproportionate impact of COVID-19 on communities of color, and especially the Black and immigrant communities, we already know that many of the people in the city of Detroit, whether they're low income or struggling to make it by in different service sector jobs, oftentimes don't have access to healthcare. And so when you're talking about access to healthcare, Medicare for all, you have to talk about racial inequities as well as immigration. And so in the city of Detroit, I think folks were excited to support because the vast majority of residents in the city struggle with these issues on a daily basis. So we see now with COVID-19, both amongst the Black and Brown communities, whether they're immigrants or not, that folks are still being forced to work, right? Like, for example, my sister works at a grocery store and is considered an essential worker. And she's lucky that her grocery store actually offers health care, but the vast majority of essential workers going to work still in the food industry don't have proper health care. And I think that's part of the conversation that is missing still, because we're talking about essential workers and folks on the front lines as being the doctors and fire and police. And it's definitely important to highlight those people, but there's still this missing population that remains invisible. And those are folks who work in the food industry and in the service sector industry who have to still go to work. And way before COVID-19, historically have not had access to quality health care. And so the challenges that they are facing, whether they choose to go to work or not, or they're kind of being, financially have to or forced to in different ways, I think that's something that's missing still from the conversation. As it relates specifically to COVID-19 and the really high percentage of cases coming up in Black communities and within the immigrant communities, a lot of the proposals we have seen don't adequately address some of the needs within the immigrant communities because you're still required to have a social security number or to be a US citizen, and that is really problematic. As it relates to the impact within the African American community, I think there hasn't been full conversation around the number of systemic barriers that often prevent the Black community from being able to access healthcare, even when it's free sometimes. And so in the city of Detroit, it was important for us to stand in solidarity with other municipalities like Seattle and support our congresspeople, Congresswoman Dingell leading the way at the federal level, because it's a no-brainer that in the city of Detroit, everyone needs access to healthcare and quality healthcare. And it can't be something that you're fighting for, or in all honesty, even if you do have it, struggle to navigate, as was used an example earlier. I mean, we know folks who may have Medicare or some type of healthcare, but it's really cumbersome to navigate through the processes, or it takes a while to get a case manager to help support you going through that process. So in addition to just having the system in place, which I know is the focus of today, it's even going beyond that to address some of the academic, the financial, just even the fears associated with going to see a doctor, some of the cultural and historical barriers that exist. I know personally for me and my family, both my mother and father grew up in poverty and in extreme situations, much more dire than my own. But even as a child growing up, we went to Chask Clinic, which is a local clinic which offers amazing free healthcare, and we were lucky to be able to access that clinic. But I remember even as a child and then in high school, looking through the papers and trying to make sure my mom opened the letters that came in the mail, because there was a sense of fear and intimidation that a bill would be in it, or not understanding the medical terms that were being explained in what was being sent out to us. And so if you don't understand it, fear kind of kicks in and people just shut it out. So even with I guess increased access is this whole other piece of the conversation that we need to be having around how to make sure access is more than just actually being able to sign up for a plan, but access is having like culturally competent providers, is having information being accessible to folks who maybe struggle with medical terms. Right? I think a lot of us struggle with that. And having social workers and a whole network of support in place so that folks, even once they do get the care, truly are able to access it and use it, I think is another piece of the conversation. But as we have the conversation, I just want to make sure that racial equity is at the forefront, because we know, again, that Black and Brown communities and immigrant communities are the ones that disproportionately have historically been suffering, and especially during COVID-19 are bearing the brunt of this pandemic because they're forced to still work to sustain themselves, and those positions that they're working in don't provide them with the proper healthcare and protection that they truly need to stay safe.
Thank you so much, Councilmember Castañeda-López, for the initiative last year in passing the resolution, and then also for your continued commitment in Detroit and beyond. And thank you so much for joining us. Now, I want to turn it back to Abraham to talk a little bit more about Michigan United and kind of maybe what are some next steps we could think of.
Yeah, so before we talk about next steps, I want to talk about something that we worked closely with the governor's office to try to get done. So believe it or not, despite this crisis, health insurance companies at the time did not commit to waive all the cost sharing, which means out-of-pocket expenses for people who needed COVID treatment. So last Friday, the Department of Insurance and Financial Services announced that they were able to get all of these insurance providers to agree to waive any costs related to COVID relief through the work and COVID care through the work with Michigan United. And I just want to go over the list of all of these insurance providers just so you get an understanding of how ridiculous this system is, right? So we have the Atina Better Health of Michigan, Blue Cross Blue Shield of Michigan, the Blue Care Network, the Michigan Blue Cross Complete. We have HAP and Alliance Health. We have Humana Insurance, McLaren Health Plan, Meridian Health Plan, Malina Healthcare Michigan, Physicians Health Plan, Priority Health Insurance Company, Priority Health Choice, Total Healthcare, United Healthcare Insurance, United Healthcare Community Plan, right? Think about how many of these companies and how many different types of plans that had to be discussed to be able to say people are getting sick, if people need to get tested for COVID relief. Why are we trying to, and it kind of exposes what is the point of having a middleman in this system. What we saw in the presidential primary, right? Not everyone's candidate won, but there's one thing that absolutely won in 2020: Medicare for all. Every single primary and caucus state this year all voted and all said in exit polls, rather, that they are in favor of a single payer healthcare system that is worked with the government, so we get rid of the middleman, so that when a situation like a pandemic surfaces, we're not having to deal with how do we make sure people get their care. The second thing that we want to also look at is understanding the medical racism. I can't tell you how many people that I know have told me that when they go to a doctor, especially my Black and African American brothers and sisters, they're automatically told, change your diet, low sodium diet, right? It's a dismissing of people's legitimate concerns. And if you saw at the beginning of this pandemic, so many people, right, who experienced some symptoms, namely our seniors in Detroit, were getting sick from COVID-19, and it was dismissed as, oh, you're just getting sick, it's fine. And as a result, we have so many people dying in Detroit. But that's not the numbers that we're seeing doesn't account for the people who are dying of likely the COVID disease, but haven't been able to get tested because the infrastructure wasn't there to provide people the access to the resources that they need, right? So that's one part of the problem as we begin to see what COVID starts to unravel. The other point is, Yusuf Rabi talked about long-term care. So Michigan United has done a lot of work with what we call the caring economy, ensuring that we are investing not only in making sure everyone has access to a single-payer healthcare system, but also thinking about all of these workers, from everyone who clean the bedpans for our seniors who have long-term care, to every single person in between who provides childcare, and then discussing how we're dealing with people so that if they are sick, they get to take time off and not have to lose their job. And then when they're taking time off, that it's backed by a union, it's backed by a living wage, because the reality is most people you will talk to, you ask any millionaire or billionaire, is taking care of your aging grandmother or aging mother worth $9 an hour? The answer is going to be no. But these are what our care workers are being paid. If you ask someone, for example, with childcare, is taking care of your child only worth $9 an hour? They're going to tell you no. So why are we treating people who are providing essential services that you cannot automate, right? The human touch cannot be automated. Why are we not dignifying them by providing them something in a living wage and benefits and to be able to collectively bargain? So we have a lot of folks, we partner with SEIU Healthcare here in Michigan to make sure that we are also trying to address the issues with all of our long-term care and nursing home workers who are trying to ensure that they're providing the best care possible, and in-home care workers to the seniors, but also are getting the same dignity that they're trying to provide for folks. So where does that leave us? Right, we have a lot of legislators. We have 14 representatives in the state of Michigan, right? And not all of the Democrats are in favor of Medicare for all. Now, what does that mean? Do we hound them and say, we don't want you, get the hell out of here, we're done with you? No, there's an opportunity to use relational organizing and an opportunity to be a democracy captain with our Michigan People's Campaign to engage people that we have our small town and rural campaign called Hometown Voices that we want you to be plugged into. And what do we expect to do? If we are able to show that city after city, town after town are voting in favor of Medicare for all, they're passing resolutions to say, we as a community support Medicare for all, what does that do? Well, most city councils have between 6 and 10 or 12 elected officials. If we are able to show these congresspeople that cities in your congressional district who have multiple people that are elected by their communities, they're coming out and saying, we are passing resolutions in favor of Medicare for all, we can go back to those elected officials, namely the congresspeople, and say, hey, look, people, you have these many cities in your district. Guess what? All of them support Medicare for all. So the suggestion that, well, it doesn't meet the political moment, right? It can't probably happen. We can show them through working with our local towns and cities that a lot of people are believing in a politics of the possible. It is possible to provide people health care. It is possible, because the second we needed to inject $1.5 trillion into the market to, quote, regulate it and stabilize it, we were able to pull that money out of thin air. But the question of it's going to cost $10 trillion or whatever number they keep trying to put out to scare people. That's just simply not true. And then someone in the comments also mentioned that so many of the Detroit retirees who during the bankruptcy, unfortunately, were given the short end of the stick and told, we're going to cut your pensions and your benefits, right? These people invested their entire lives working for a city. Then they were then told, we have to take some of these benefits away, and they still haven't gotten them back, right? Had we had a Medicare for all single payer system, folks wouldn't have to be worried so much about, will my employer continue to provide care? And then before I pass it back to Melinda to talk about how we're going to use it, I want to share a personal story. But before I do that, I want everyone to do me a favor. If you go on your app store, whether you have an iPhone or an Android device, if you look up Outvote, O-U-T-V-O-T-E, it's one word. It's an application that we are using to relational organize people that we know, people that we love. And this is our chance to try to engage them about Medicare for all. So once you download the app, Outvote, one word, O-U-T-V-O-T-E, you're going to go ahead and make your profile, and then you're going to look for Michigan People's Campaign. Once you find that, we're going to build a system and a model for us to be able to engage people that we know in communities that we think we can put pressure on. People like Congresswoman Haley Stevens, that we can look at communities like Canton and say, hey, why don't we push for Medicare for all? Or communities in Representative Slotkin's district and say, there's an incentive, right? We can provide them a carrot and say, there's an incentive to show you that Medicare for all works and Medicare for all is popular. And then the final point is, look, healthcare, everyone has a healthcare or a care story. And I want to encourage folks to try to center yourselves when you have discussions, because it's not enough to simply talk about, everyone deserves healthcare. And everyone has a moment in their life where they've been impacted by healthcare. And I'll use a story with my brother. I have an older brother who has severe autism, right? Life was already a little bit challenging for him because he wasn't able to care for himself. So he always needed someone to be by his side and care for him. My brother loved to swim. So my dad took a whole lot of, we live in a small city in Hamtramck, but he decided, I'm going to invest some energy, some of my money to build a swimming pool for my brother, because he loved to swim so much. And in 2013, my brother got extremely sick, and he was sick abroad. We had to transfer him to a hospital in Paris because Blue Cross Blue Shield said, we are not going to pay for an air ambulance to send him home. Instead, we will find a hospital that is in our network that can care for him. So I flew to Paris to meet my brother to care for him, assuming we were going to be there for no more than 2 weeks. So I packed a duffel bag, 6 pieces of clothing for him, 3 pieces of clothing for me, and I traveled to Paris. 2 weeks ended up being 3 months. And my brother's life was altered forever. He now is dependent on a full-time trach, so he breathes out of something the size of a McDonald's straw. He lost all motor function, or most motor function in his legs, critical illness, neuropathy, myopathy. He is not able to communicate because the trach blocks access to his vocal cords, and he has diabetes. Now, his life was changed forever, and his desire to swim is all but ended because he cannot go in underwater because there's no way to seal that and be able to hold his breath. And the most painful thing about what happened to my brother was not the story of what happened, but the experience of what we had to deal with insurance. Fighting Blue Cross tooth and nail to eventually bring him home because they realized that they were paying $6,000 a night for an ICU bed, just for the bed, and he wasn't getting better. And then dealing with making sure that anytime he has changes in branding of the equipment he uses, and he needs a lot of equipment, that we have to get prior authorization every single time and call the doctor and then call the insurance company, then call the medical service or the medical equipment provider, back and forth, back and forth, back and forth. Right? That's been the most difficult thing. But my brother is fortunate to have 7 siblings and 2 parents that are still around and are able to provide care for him. Now imagine the people that don't have 7 siblings that can help care for their brother. Imagine the people who are a single parent, who have to make the evil decision of, do I go to work so I can provide food for my kids, or do I take care of my child when they're sick and maybe not be able to feed him? next week because I won't get a paycheck because I don't have paid time off. These are the people that we have to center as we talk about reforming our society and building that politics of the possible. And you all have the opportunity to do that in a program like relational organizing. And it can start by simply getting your cities to start saying, we support Medicare for all, so then we can go to the Congress people and say, your district has 12 cities. 6 of those cities are in favor of this incredible policy. So to talk more about that initiative, I will pass it back to Melinda to discuss how we build the city and town Medicare for all resolution campaign. Melinda?
Thank you. Perhaps before I jump in, Hebah Kassem from the Congressional Progressive Caucus Center, who is also a Michigan native, did you want to say a few words, and then I'll jump in and talk a little bit about the resolutions campaign?
Yeah, and I can keep my remarks brief so we can get to Q&A. First of all, I just want to thank Melinda and Brittany for all of their efforts on the resolutions and all of our panelists for being here today. And you all took all of my talking points, so we're all on the same page. Couple of things that I wanted to add, because I know each of you actually mentioned something that's really important. Abraham, you mentioned the primary results from the presidential election in Michigan. An exit poll found that 58% of Michiganders support Medicare for all, regardless of the candidate they supported in the presidential election. And State Representative Yusuf, you mentioned that Medicare for all would actually save us money, and there are 22 studies that show that we will save a lot of money. I think it was $450 billion over the next 10 years with Medicare for all. And then communities of color are very impacted by COVID-19. In Michigan, we're seeing that 14% of the population are Black, but they are making up 40% of the COVID-19 deaths, which is absolutely ridiculous. So I just wanted to very briefly talk about the CARES Act and thank Congresswoman Dingell and all of the members of Congress who worked really hard on it. They did a great job of making sure that all Americans are supported and during this pandemic. Unfortunately, some communities were left out. As the council member from Detroit mentioned, undocumented immigrants were left out. And so we still have a lot more work to do. And I know members of Congress and advocacy groups are fighting really hard to make sure that they are included in the next package. So, sorry, I'm just gonna go over my notes to make sure I don't miss anything. And then I did want to recognize all of the members in Michigan who are in support of Medicare for all. We have 5 members who are co-sponsoring the Medicare for all bill. Of course, our champion who's leading the fight in Congress, Congresswoman Dingell, and then we have Reps Rashida Tlaib, Andy Levin, Brenda Lawrence, and Dan Kildee. And I just want to take a second to recognize Reps Tlaib and Levin, who have been very vocal on Medicare for all and have really been very, very supportive in the fight for a single-payer healthcare system. And so it is very, very important that we all get involved at the local level and at the state level. And so I'm going to turn to Melinda now to talk about the resolutions efforts and what we can do at the local level to really push all of our members of Congress to really support Medicare for all and do what they need to do for all of us.
Thank you, Hebah. And thanks to Abraham and to everyone who has made the case so forcefully. You know, I think we know, we don't need any more arguments because it's so clear that this is the policy that we need, and it's actually insane and cruel that we don't already have it. And it's really a matter of the outsized influence of the moneyed interests that want to maintain the status quo is the only reason why we continue to have an insane system that ties our healthcare to employment, that does not provide healthcare to people who need it in the middle of a global pandemic. So as Abraham mentioned, we are part of a large coalition, a national coalition that includes People's Action, and Michigan United is a member of People's Action, Indivisible, Our Revolution, Center for Popular Democracy, National Nurses United, Physicians for National Health Program, and many other organizations that have been pushing for the last year for local jurisdictions, city and county councils to pass resolutions in support of Medicare for All. There are currently more than 300 efforts are underway around the country that we know of, and we know there are actually many more, but those are the ones that we have on our map that you can, Brittany just put into the chat. It's medicareforallresolutions.org. But we have a map of efforts that are underway, and I'm just sharing my screen here to show you that this is the website, and here is the map that we currently have of resolutions that are underway around the country. We'd love to add some more in Michigan, and Lopez was one of the first in Detroit to pass a resolution. And but we also have we've had important wins from large cities like Los Angeles and Chicago's Cook County, small towns in Pennsylvania and Ohio and purple states. We've Tampa, Florida, Tucson, Arizona. So we're showing that this is a policy that is popular, not just in blue districts, but it's also something that people across the country are demanding. And this tactic of using local governments really can play an important role because local governments, as we know, like they understand the consequences of our inequitable health insurance systems. Their municipal budgets are strapped because they can't afford rising health insurance premiums for their employees. Local businesses are struggling because they can't, because of trying to provide health insurance to their employees. And then, of course, with COVID-19, it's local governments that are having to provide the frontline response when their community members are becoming gravely ill or dying needlessly, or facing medical debt bankruptcy after receiving thousands and tens of thousands of dollars in surprise medical bills. So local governments can help to shape the national public narrative, and we hope that this is something that when we get through the worst of this crisis, that we can help and provide support for activists to do grassroots-based building along these lines. So that's the map. We also have on here tools for activists, so step-by-step toolkit on what you need to do to contact your member or to your council members, talking points, etc. And we have and we now have special resources around COVID-19 and talking points. Writing a letter to the editor or op-ed is an excellent thing to be able to do right now when everyone's stuck at home. But we are here to support virtual meetings. It's really important in this time of social isolation for us to be connecting with one another and helping to make some of these plans. So these are just some of the resources that we have and would love to, to work with any of you and with Michigan United, Michigan for single payer healthcare as well. And so with that, I want to turn it over to Eli Rubin with Michigan for single payer healthcare to talk about some of the work that they've been doing as well. And what we really hope is for everyone who's been a part of this tonight, we want to plug you in. And if you want to get started in your town, we will try to help find other people to join you, or we'll plug you in with other activists that are already underway. So with that, I'll turn it over to Eli.
Thanks so much for inviting me and us to be on here. I'm going to just share some of my time with Bill Farmer, who's one of our board members and who has been carrying out a campaign in conjunction with Southwest Michigan DSA in Kalamazoo. So I guess, for the few minutes that I'm going to talk so we can get to questions, first of all, I just wanted to say a big thank you to you guys, but also to Michigan United. Like many grassroots orgs around the state of Michigan, we got our starts with them, trained by them, inspired by them, use their offices, like everything. They're a huge catalyst around the state of Michigan. And we are really like purely volunteer driven, grassroots. I mean, we just go out and knock on doors. We just go out to farmers markets and, baseball games and, county fair, wherever, and just stop people and talk to them about Medicare for All. And we do town halls, and we've been incredibly fortunate with Yusuf and Representative Dingell to help us with that. But the number one thing that we've come across is that people are not super ideological, even in so-called, conservative, rural, white working class areas. But the number one thing that comes across about this topic is everybody has a healthcare horror story. And B, everybody is super, super cynical. Nobody thinks that the politicians, Democrats or Republicans, doesn't matter, are going to do anything about it. Everybody thinks the politicians are bought and paid for by the health insurance industry. And so the way I see this, I think the resolutions campaign is great. I can't wait to, pull together our networks and our partners' networks, and people, and we have a lot of networks built up over the last few years, whether it's us, DSA, Michigan United, a bunch of groups. But to do the work on the ground while the people in Lansing and Washington are really doing the work on like the airwaves, for example. Frequently when we talk to Dems who are not on board, they'll tell us, privately we're on board, but we don't want to come out publicly and say anything. So you have to go out and talk to people. And unfortunately, there's just, it's very difficult to cover all 10 million people in Michigan. So there really needs to be a joint effort by those at the top and those on the grassroots. And we really need politicians to use their bully pulpit to get on the Sunday talk shows, to get on CNN, and really make all these points to the American people. So I'll just stop there and let Bill Farmer say a little bit about the specific campaign that he's been working on in Kalamazoo.
Thanks, Eli. Greetings, everybody. It's great to see everybody on this call. I do not work alone. We have a very good, I'll bet, small group of committed activists that have been working on this, some of which are on this call right now. I just want to give credit where it's due. What we've been doing probably since last summer is a petition campaign and a resolution campaign, both targeted at the city and county commissioners of Kalamazoo County. We've gone door-to-door canvassing, we've done group canvassing, crowd canvassing over those months until we could no longer do it with this virus that's going around. But we've made contact with a county commissioner. That's going to be our first target. He is very much in support. He's lobbying the other commissioners. And we have over 400 signatures from within the city and county, specifically in support of the resolution. The resolution we basically stole from NNU and your organization and just made some amendments for our particular use. We're in the process of putting together a package of information that'll be available via email to present to the commissioners after we make initial first contact. So we're moving forward, we're hopeful. The whole purpose of doing neighborhood and community canvassing is to build a movement that not only influences the electoral process, but is building what we believe is really necessary as an ongoing grassroots neighborhood organization that's going to be able to do direct actions in order to force the issue. So that's our story. I did not get health care easily, just as a personal story. It was in 1955. And it was a result of 3 major strikes by the UAW of hundreds of thousands of members of the UAW nationwide that impacted the economy. And that's how I received, and our family at that time received healthcare. And what healthcare is now based on is employer healthcare. So we're trying to build a movement with those kinds of principles and qualities, also involving the Democratic Party and all those who will support this, this movement. We think that by indications, this process will take 2, possibly 3 months. We've started this process, and we hope to be very successful. After the county, we're going to move to the city. After the city, we're going to move to area jurisdictions and move west within the context of the 6th Congressional District. So that's our plan. And thanks for your time. And all of you, please continue your very vital work.
Thank you. Thank you so much. So we, I am so honored to have heard all of these stories, all of the great organizing, the amazing advocacy from our elected officials and grassroots organizers. We're getting close to the hour, but I think there have been some questions that came in on the chat. So if any of our panelists would like to make some last comments based on the questions that have come in, I will open the floor to do that. Congresswoman Dingell, is there anything, or council member or state representative Rabhi, would you like to say anything before we end?
I'm trying to look at, there were a lot of questions. I've been doing a lot of Zooms, and there's more questions on this chat than I've seen in a lot of other chats. So I think that shows that people are really engaged, and I want to thank you for that. I think, Melinda's public citizens heard me on some other town halls or conversations, and I'm more optimistic than some people are. I think that the times that we're in are really scary. They're causing a lot of anxiety, but they're causing a lot of people to stop and think about what's going on in our country. And I think we're going to bring our supply chain back to this country. I think we're going to do a lot of other things, but I think this has forced people to look at our healthcare system in this country. And I think the fault lines have really been shown. And I think we have to, if there's a silver lining, and I don't really think there are a lot of silver linings in what's going on right now, but I'm trying to be an optimist. It's that we can maybe get some people who've been afraid to talk about this or haven't wanted to talk about it, to talk about it. And I think we're going to get businesses to start to support it. When I talk to small business owners, even when I talk to large corporations, their biggest cost continues to be healthcare. And yet we spend more than anybody else. So I think all of those who tuned in and who cared, now is a chance and you can talk to people without going to big meetings or going to town hall meetings. Now's a chance to, or actually there are a lot of people that are prisoners in their homes. You find a way to communicate with them. Tell them why you care and put it in really personal terms. Tell your elected official why this matters to you. Give them a story of something that's happened during COVID-19. Make it real and tell them you need them to care, and this is the time for the country to step up and make a difference.
To that point, Congresswoman, I think, thank you, Debbie, appreciate you always. Someone once told me this in the People's Action Network. They said, Abe, never let a crisis go waste, never waste a crisis. And everyone and their mother is being impacted by something related to healthcare, because this is a health pandemic. It is a public health crisis. So if there's any moment to take advantage of a crisis, it's right now. And for those of you that don't know who you should reach out to, like I said, I just want to bring up Outvote again. So this app will actually let you identify where people live. If you upload, so you get to decide who you upload into your contacts, and then we match it with the voter file. And then once you realize, you have a friend who's a frequent voter who lives in this congressional district or this legislative district or in this city, it won't give you their full address, but it'll just tell you where they're registered to vote. you could then be a little strategic about how you're having these conversations, because this moment demands us to relational organize. The only people we can reach out to are the people that we know. I don't want to get a random text from like Joe from the Mike Bloomberg campaign. I don't want to talk to Joe from the Mike Bloomberg campaign, right? I want to talk to my friends. And everyone's at home. Most people have phones. Why not take advantage of it? So that's really the best way to try to engage folks in relational organize, and then start having conversations with your elected officials. Yusuf will tell you, he's at home. Debbie just said she's been at home for 34 days. I'm sure you can find a way to email them. You know, Raquel the same way. Say, hey, I want to talk to you. Schedule a Zoom call. Say, let's figure something out. Co-govern with these people so that you can then push forward what you believe in your personal story. And they can't tell you that it's not true. You're literally locked in your house because of this virus. So, you know, take advantage of the crisis. Try to, you know, milk something good out of it.
I would just add, I think for me being in the city of Detroit, in a way, folks tend to like want to focus just on Detroit. And I understand the reasoning why, but it's almost like we become people's guinea pigs or poster childs, and people are like projecting and exoticizing us in different ways. And it's really frustrating. I would say even that happens sometimes with different progressive movements. And so people, and the other thing that happens too is like, if you're seen as an ally, then people will go to you for everything. And we kind of forget that there's other people that need to be brought on board. So I think one is making sure you're not just going to like where the epicenters. I mean, there's folks that are there trying to work on the ground, like obviously Michigan United has an office here and other grassroots organizations, but I almost feel like people want to get involved, and it almost becomes like this, I want to save and help, you know, those poor people suffering, and that becomes very patronizing, and they then gravitate towards where the problem is happening at higher rates. And so support is appreciated, but you also need to do the work in your own communities. And I think multiple people have echoed that today. Like, organize on your own block, organize in your own municipality to get other folks on board, and don't get distracted, I guess, by larger cities in the work that they're doing, because we really need support statewide. It can't just come from Southeast Michigan. And then the other piece is, I guess I would say, I don't necessarily go around calling myself progressive, but as the person who grew up in poverty, I think that fights for people's basic rights, I would define it that way. I get, you know, asked all the time from different groups advocating for different things, and it becomes overwhelming at some point. And I'm like, hey, have you asked this council member? Have you asked, you know, this elected official? And they folks tend to gravitate to folks who they think are, you know, the most progressive. And I understand again why that happens, but at the same time, you cannot have just one person kind of carrying the torch. You need more people. Like, I need 5 folks to get something voted on, right? Yusuf needs more than that to get something voted on and passed. So you have to think about it of building the coalition, and again, building those relationships. And it's more than just, I would say the last thing I would say, it's more than just about this one win of Medicare for all. We have to stop thinking about campaigns in a way that's just kind of transactional. I think someone hinted at this earlier. That's more transformational, because it's about transforming people's quality of life and transforming our society as a whole. And so it's not just about getting, you know, this one vote on this one thing and then you're done. It's about investing in those long-term relationships and doing the base building over time to then be able to transform the communities and society that we're living in. So just wanted to highlight that. And again, thanks everyone for having me on this town hall webinar. I appreciate it.
Thank you so much. State Rep Rabhi, did you want to make any last comments before we end?
Sure, yeah. It's kind of too bad that we can't take questions, but I hope folks do reach out to my office. My email address is just my name, yusufrapi@house.mi.gov. So if you do have questions about my care, or, you know, just general questions, please reach out. Want to thank everybody for being on this call and for actually having this fantastic opportunity. You know, I want to echo just a few of the comments that were made and expand a little bit too. This crisis that we're in right now, you know, a lot of people have asked me how do we organize? How do we activate? What do we do right now? And one of the things I want to remind folks of is we have to remember that we will get through this. And when we get through it, we have to not go back to the way things were. we have to create something new. We have to, this is an opportunity for us to reshape society on the other end of this. And the question is it going to be a society that cares about our neighbors, or is it going to be back to business as usual, where rich CEOs are lining their pockets with our money? And I think we really have an opportunity here. And so let us, let us use this time that we are at home, that we're in front of our computers. Let us use it to dream about a society that we can build, about a future that we can build when this is all over. And we need to use this time. We need to use this time to build that framework, to build that activism, to build those networks, to call your friends, and to begin that process. And I know many of you have been engaged and active in this for a long time, years. But the other piece of that is to get outside of your comfort zone, right? And to call people who you have maybe not communicated with in a long time, people that may be, folks that are on the other side of the aisle, family members who last Thanksgiving you really didn't want to have a conversation with. It may be time to pick up the phone and check in on them and have a conversation with them and see if you can find some common ground around issues like this. Chances are good that you will. And I know that Eli was mentioning this before, but his group goes out and has these conversations with people that are not your traditional Medicare for all single payer healthcare supporters. And they say, hey, what do you think about this? Let's break this down. And a lot of folks at the end of the conversation turn around and say, hey, that's a great idea. One of the things that I think a lot of this comes down to, and I had a conversation in the coffee shop near my house maybe like 6 months ago with a gentleman who was a Trump supporter. And I was asking him about single payer healthcare and what he thought about that. And, and one of the things that he said to me is, he said, I'm all about the idea of single payer healthcare. It sounds good. But one of the things that I need to see first is a government that I can trust. Can I trust government to manage my money? Can I trust the government to do what is right for me and my fellow Americans? And I think that's really fundamental to what we all should be fighting for in the end, is a better government. It's a government that should not be so dependent on money and politics, which is one of the underlying issues with this issue. It's the amount of resources that ultimately come out of our pockets that these insurance companies are spending on candidates and political parties that ultimately will influence what ends up happening. And I want to say, not every politician is influenced in the same way, but we have to acknowledge that money in politics has a dramatic impact on the types of policy that we then see presented, and the willingness of elected officials to step up and say, yes, this is a good idea. Yes, I will fight for the people. And I know that we have a lot of work to do in that regard, but this is the time to be planning, to be building, to be organizing. This is when we can make a difference. This is when we can build a better future. And when we come out of this, we cannot go back to normal. We have to build something new. We have to build something better. So thank you all for tuning in.
Yes, I think that is the perfect way to end this webinar, which we know is just the beginning of our organizing, and want to thank everyone. Thanks so much to our distinguished panel, and thank you so much to all of the Michiganders who tuned in today and engaged so much in the chat, and I know will be engaged going forward. Again, please get involved if you haven't already, and count on us to help Michigan United, Michigan for Single Payer Healthcare, and the Resolutions Campaign. We're all here, and thank you so much. And please stay safe. in these challenging times. And thanks again to Abraham and Michigan United for co-hosting this. Please take care of yourselves, everyone. Good night.
Thank you, Melinda, for organizing us. And Abraham, Eli, everybody, thanks, guys. And you make someone not feel alone.
Thank you, Representative.
Thank you, and thank you, Congresswoman. Okay, take care, everyone. Good night. Good
Good night,
night.
everybody.